My name is Lori Knutson, and I am a registered nurse. I'm also boarded in holistic nursing. I have been a nurse and a healthcare administrator for almost 30 years. The last probably 25 of that actually in integrative healthcare. I've worked health systems, and I have also worked community health, which is where I am now. Just recently opened up an integrative mental health center in Minneapolis. Integrative mental health is really the combination of both physical and mental health, although people walk in the door with more mental health concerns, but we focus on the whole person, just like we do in a physical health or integrative physical health clinic. And right now, the clinic that we have is very small. It's in the community. We have a nurse practitioner, massage therapist, acupuncturist, fitness center, health coach, and a lot of different classes, group classes, such as group acupuncture, yoga, tai chi, all focused really on the whole person, but we understand that those walking in the door have a mental health concern. I started integrative nursing really probably in the early 80s. I had just graduated from nursing school and was focused in physical medicine and rehabilitation. And in working with people with disabilities, I realized there was a limitation that conventional medicine had. And I started focusing on other resources that were out there and really did it very secretively, because back then you just did not do what was called complementary or alternative medicine. And I actually became trained as a biofeedback therapist and started using that. So that was truly when I was in my 20s was when I started realizing that there were other things that helped heal and cure individuals. First experiences for myself that I deeply remember and continue to hold on to is with a patient and family whose son had a spinal cord injury and was paralyzed from the neck down, and at 16 years old. And that was such an emotional time because I was in my 20s, and connecting with somebody that young who was now disabled for their entire life, and the extraordinary change that this entire family was going through. One of the things I think that really resonated for me was his ability to find quietness within himself. And he actually taught me more about meditation in those moments when he was suffering and wondering, can I live this kind of life? But his sense of peace, his sense of understanding that he had all this amazing support from his family, and that interpersonal connection that he had with them was part of the healing process. And I just remember being in the room and being in that moment and feeling that sense of presence. And I think for me, that understanding of what it is to heal in a relationship with people was so much bigger than the disability that he had. I think what I am hoping for from a future perspective is that we actually don't even have to have the title of an integrative nurse. I hope that in the future, nursing is all integrative. And I think we're getting there.